The title slide shows a photo of a woman working behind the counter in a cafe setting. The logos for OPRE and Mathematica are seen at the top. The host reads the presentation title and introduces herself.
Good afternoon or good morning, everyone, and welcome to this webinar, which is What Works During Economic Recessions and Recoveries, the Pathways Clearinghouse, Evidence and COVID-19 Response. My name is Diana McCullum, and I'm the Project Director for the Pathways Clearinghouse. I'm also a Senior Director of Research and Evaluation for our Children, Youth, and Families area at Mathematica. I'm really excited to be moderating this important webinar and sharing with you some really interesting findings based on a recent paper that my colleague Alex Stanzik conducted. When we started this paper, the vision was really to think about how we can bring prior evidence from similar economic periods to bear on the current decisions that TANF administrators are making, or leaders of human services organizations and leaders of community-based organizations. We see these organizations as the ones that are really critical in helping individuals, especially those with low incomes, but to secure employment during these uncertain times. And this paper focuses on what we know from the literature that the Pathways Clearinghouse has reviewed, focusing on the impacts of employment and training programs implemented during past similar economic periods, so during recessions, recoveries, and stable periods. This research is just one of the several syntheses that we've been developing as part of the Pathways Clearinghouse to help distill findings from existing reviews of interventions and studies. In addition to summarizing the evidence on interventions, we also, we produce summaries to help practitioners and policymakers use research to be able to make evidence-based decisions. So here's just a brief overview of our presentation for today. I'm going to start off by providing introductions for each of our panelists. And then because the findings today really draw on the research that's already been identified and reviewed by the Pathways Clearinghouse, I'm going to give a brief summary of the Pathways goals and our processes. Then I'm going to turn the presentation over to Alex, who will summarize the findings from the syntheses that she's conducted of interventions that are implemented during recessions and recoveries. Then we will make time and turn this over to a discussion with our panelists so that they can share their thoughts and reactions to the research and really start to talk about how we can use these findings to drive decisions in the future. And we will certainly have time for our audience questions as well. So if you have questions, please add them to the Q&A box as we go along.
Headshots for the panelists are shown. Left to right are Diana McCollum, Alex Stanzik, Julie Fong, and Christina Meza.
All right, so I'll start off with our introductions. So Alex Stanzik is a researcher at Mathematica, and she led the development of the paper and associated brief. She has more than 10 years of experience working in and studying programs that support economic security among people and families with low incomes. Her research is really wide-ranging and focuses on policy and program impacts and the implementation of these programs in the areas of TANF, employment, work-family policy, job quality, child welfare, SNAP, and healthy marriage and responsible fatherhood. We also have Julie Fong, who is the Region 9 TANF Program Manager for the Administration for Children and Families at the U.S. Department of Health and Human Services. In this capacity, she provides leadership and oversight to a broad team of program specialists in providing regulatory and program oversight, technical assistance, and guidance to tribal, state, and territory governments as they implement different federally funded TANF programs. We also have Christina Meza, Chief of the CalWorks and Family Resilience Branch, who joined the California Department of Social Services in January 2019. Christina transitioned to the CalWorks and Family Resilience Branch in July 2020, supporting program operations during the pandemic and the transition to early learning and care programs from the California Department of Education. Prior to joining the California Department of Social Services, she managed workforce development programs for an Orange County based nonprofit agency. So now I'll provide a brief overview of the Pathways Clearinghouse so we're all starting on the same page.
The home page of the website is shown. The web page is comprised of a banner at the top with the Pathways to Work logo. To the right are links to sections titled Find Interventions That Work, Other Pathways Resources, About, and Help. Below the banner is a photo of a woman using a caulking gun in a construction setting. The website address is pathwaystowork.acf.hhs.gov.
So the Pathways to Work Clearinghouse really began through a congressional mandate where Congress directed HHS to create a database of projects, which we refer to as interventions, that have used what they called a proven or promising approach to move welfare recipients into work. So with this in mind, the Pathways Clearinghouse really has four key goals. The first and the foundation of our work is to conduct a systematic review of the impact evaluation literature on employment and training focused interventions for individuals that have low incomes. This review needs to be transparent and comprehensive, and we house the results of this review on the Pathways Clearinghouse website. And you can see the link for that in the bottom corner. The next step is to rate those interventions according to pre-specified criteria that we've developed with HHS to determine if the programs or interventions that we've examined demonstrate evidence of effectiveness at improving outcomes. So interventions are rated as having outcomes that are well supported, supported, not supported, having mixed support, insufficient evidence, or no evidence to assess support. Interventions receive effectiveness ratings within multiple outcome domains. So when I say that, we're interested in the impacts of employment interventions on increasing employment and earnings, reducing public benefit receipt, and increasing education and training. So those are really the four key outcome domains we focus on. You can find the results of this process through the website's Find Interventions That Work portal. The third goal of the Pathways Clearinghouse is to make sure that we're presenting this information on a high quality and really user-friendly website, which I'm showing here. But the website is designed to present the review's findings. In addition to information about interventions, the site also has other resources such as videos that show how to navigate the website and products that synthesize what we're learning from the evidence, like the work we're talking about today. Once available, these products can all be found under Other Pathways resources. Finally, an active goal of this project is to promote the website and ensure that key audiences are aware of its usefulness. So one thing we have really focused on is obtaining expert input along the way to inform the goals that are guiding the clearinghouse. And when I say experts, I'm thinking of the end users for this work, which include TANF administrators, workforce development providers, policymakers, and researchers. We've really been actively engaging with all of those groups along the way. We want the Pathways Clearinghouse to be informed by the wisdom, insight, and guidance of all of those audiences. So we've had several meetings to get their input on things like the design as well as the content. So we really welcome continued feedback on that. All right, so with that, I'm going to turn it over to Alex to talk about the results of the synthesis, focused on understanding the types of interventions that are most likely to help during recessions and recoveries. This analysis is designed to inform practitioners and policymakers about the interventions that are really most likely to help during certain economic conditions, and help them to make both short-term pivots and think about plans for the long term. So have those, have questions in mind related to that as you're thinking through the webinar. All right, so Alex, I will turn it to you.
Awesome. Thank you so much, Diana. So I want to start off by sharing the findings at kind of a high level. But before we get there, we're going to do 2 poll questions to get you all thinking about what results you might expect. Okay, so our first question, which types of interventions do you think will have the greatest impact on employment and earnings among people with low incomes during recessions? And for this report, we define recessions as times when the national unemployment rate is rising quickly. Do you think it would be case management or other supports? So, for example, things like intensive case management interventions or health services? Do you think it'd be education and training, employment retention services interventions, employment services interventions, incentives and sanctions, or work and work-based learning type interventions? You can go ahead and pick on the poll which ones you think would be most likely to have the greatest impact on employment and earnings during recessions. And we'll give you guys a few minutes to think.
The poll results are 35.7% chose case management or other supports, 37.5% chose education and training, 32.1% chose employment retention services, 32.1% chose employment services, 26.8% chose incentives and sanctions, and 44.6% chose work and work-based learning.
Okay, so it looks like the audience is pretty mixed. I think the highest percentage goes to education and training interventions, and then next to case management or other supports. But it seems like the audience, oh, excuse me, work and work-based learning was the highest. That was covered on my screen. But it does seem like the audience thinks that all of these different types of interventions could be effective during recessions. Next question. Now, which types do you think would have the greatest impact on earnings and employment outcomes among people with low incomes during recoveries? And for this report, we define recoveries as times when the national unemployment rate is dropping quickly. The list of interventions is the same. The list of intervention types, I should say, is the same. So take a look at the types of interventions and pick one or two or three that you think might be most impactful in connecting people to work and earnings during an economic recovery.
The poll results are 29% chose case management or other supports, 44.9% chose education and training, 30.4% chose employment retention services, 42% chose employment services, 15.9% chose incentives and sanctions, and 44.9% chose work and work-based learning.
Okay, let's see. Okay, so during recoveries, so again, times when the unemployment rate is falling, it seems like there's a little bit more distinction. The audience, again, thinks work and work-based learning and education and training type interventions might be most effective, but there is a lot of votes for employment services interventions as well. Okay. Now that we have a sense of what you all would expect, I want to start out by taking you to what we found when we looked at the data. The figure on the slide lists the types of interventions with evidence of effectiveness in recessions, recoveries, and stable economic periods.
The table is made up of 3 columns for recession, recovery, and stable periods. A line representing the unemployment rate rises during the recession period, then peaks and decreases during the recovery period, and levels out during the stable period. In the recession column are case management or other supports, employment services, and work-based learning. In the recovery column are education and training, work and work-based learning, employment services, case management or other supports, and incentives and sanctions. In the stable column are education and training and employment services.
Through our scan of the studies that the Pathways Clearinghouse has reviewed, we found that different types of interventions are most effective during different economic conditions. For example, you can see that case management interventions have the largest effects during recessions, but education and training interventions have the largest effects during other economic periods. You can also see there's a lot of differences across the list, and only one type of intervention seems to be effective across all 3 phases, and that is employment services. Employment services interventions provide services to help people prepare for, find, apply to and obtain jobs. This could include things like job search assistance or job development interventions. Okay, so now that we've previewed our high-level findings, I want to walk you through the analysis I led to get us to these findings. Then I'll give you more details on what we found, and we'll discuss implications. So for this synthesis, we included almost 1,500 findings on the effects of employment and training interventions on earnings, employment, public benefit receipt, and education and training outcomes. Although the Pathways Clearinghouse catalogs both short-term and long-term findings in each of these domains, we didn't look at findings related to effects on short-term public assistance for this analysis, because during a recession in particular, we might not want to actually reduce public assistance receipt. All of these findings focus on comparing an intervention group that received an intervention to a comparison group that did not. Therefore, the findings that we analyzed for this report reflect the effects of interventions relative to services typically available and provided. These findings came from 188 studies on over 140 interventions, which is actually a subset of all the studies and interventions that have been reviewed by the Pathways Clearinghouse. To do this analysis, we assigned each study to a group based on the economic conditions that occurred during study enrollment. We used an employment-centered measure of economic conditions. So, as I mentioned, we considered it a recession when the national unemployment rate is rising quickly, and a recovery when the unemployment rate is falling. Stable periods were those in which there was no strong upward or downward trend in the unemployment rate. As you all might have thought about during the poll, there are many reasons why economic context might matter for intervention effectiveness. Past research suggests a few reasons why intervention effects might be different during a recession or a recovery or a stable period. For example, employers might be more or less selective in these periods. The cost of training, which can include foregone earnings while the person is involved in training, could be lower or could be higher. And it could be that more or different types of people might be competing for jobs or seeking intervention services during these different periods. Okay, getting to our results.
A bar chart is shown comparing the number of interventions implemented in each type of economic condition, with the number of interventions that have shown to improve outcomes. A gray bar represents the total number of interventions implemented, and a blue bar represents the number of interventions that have shown to improve conditions.
So overall, the good news is that there are many interventions that have been shown to improve outcomes in each type of economic condition. The Pathways Clearinghouse identified 30 interventions implemented during recessions. Of these, 8 are just over 1/4, that's the blue bar, improved participant outcomes on average. For recoveries, we identified 95 interventions. 22 of these, again about 1/4, improved participant average outcomes. Finally, we have 33 interventions that were implemented during stable economic periods. 6 of these, or about 18%, improved participant average outcomes. Similarly, we see that the average impacts of interventions are positive during each of the different economic conditions.
A line chart shows the average effects across outcome types, converted into annual earnings terms. Overall, there was a gain of $1,046. During a recession, the gain was $837. During a recovery, the gain was $1,297. And during a stable economic condition, the gain was $690.
Overall, so that is when we don't look separately by economic conditions during the study enrollment, interventions had an impact equivalent to increasing annual earnings by about $1,000. So that's the dot in the at the top in the light blue. And then impacts are larger in recoveries. The average intervention implemented during these periods had an effect equivalent to raising annual earnings by about $1,300. And impacts are smaller, but still positive and statistically significant during recessions and stable economic conditions. While we're on this slide, we wanted to note throughout this presentation and also in the accompanying report and brief, we present estimates in terms of equivalent increases in annual earnings in 2018 dollars. But we actually calculate averages using impacts on employment, earnings, public benefit receipt in the long term, as I mentioned, and education and training outcomes. So not just annual earnings. We do this conversion to make the average effect estimate easier to make sense of. Okay, so to dig deeper into what improves outcomes among people with low incomes during different economic periods, we also grouped interventions based on their primary service, and that is the service that most strongly distinguishes the intervention. This allows us to better understand what types of services might be helpful under different conditions. The 6 types of primary services we considered are listed on the slide. So case management or other supports interventions focus on assessing clients' needs, linking clients to other available services, and providing other supports to overcome barriers, such as substance abuse counseling or classes to promote financial literacy. Education and training type interventions focus on providing or supporting an individual through education and training programs. Employment retention services focus on helping employed people keep their jobs and progress in their careers. Education and training interventions focus on providing or supporting an individual through education and training. Employment services help people prepare for, apply to, and obtain jobs. Incentives and sanctions focus on providing or taking away cash or non-cash benefits, such as public assistance benefits or funding for childcare. And finally, work and work-based learning interventions focus on providing clients with work and on-the-job learning opportunities. So, during recessions, the evidence supports interventions using 3 of these primary services.
A bar chart shows the average effects of interventions implemented during recessions converted into annual earnings terms. Case management or other supports had an increase of $1,652. Education and training had an increase of $126. Employment retention services had an increase of $230. Employment services had an increase of $1,485. Incentives and sanctions had a decrease of $21. And work and work-based learning had an increase of $1,025.
Interventions focused on case management or other supports improve outcomes the most in these periods by $1,652 in annual earnings terms on average. Interventions focused on providing employment services also improved outcomes during recessions, as did interventions that focused on providing individuals with jobs or on-the-job learning experiences. So that's the work and work-based learning category down at the bottom. The evidence suggests that education and training interventions that help people maintain jobs that they already have, and interventions that provided incentives and sanctions, such as something like a reemployment bonus, did not seem to improve average outcomes during recessions. Another way of looking at intervention effectiveness during recessions is to compare average effects for interventions of the given type that were implemented during recessions to interventions of the same type that were implemented during stable economic periods.
A bar chart shows the differences in average intervention effect during recessions versus stable periods converted into annual earnings terms. During recessions, case management or other supports had an average increase of $1,050. Employment retention services had an increase of $96. And employment services had an increase of $456. Having a lower average effect during recessions were education and training with an average decrease of $1,724. Incentives and sanctions with a decrease of $111, and work and work-based learning with a decrease of $504.
In this graph, we show the differences in average intervention effects by type, comparing recessions to stable periods. Positive numbers, or bars in the right direction, indicate that an intervention is more effective during recessions than during stable periods. Negative numbers, or bars in the left direction, indicate an intervention is less effective during recessions as compared to stable periods. So when we look at this figure, two things jump out from the comparison. First, it looks like interventions focused on case management or other supports have larger effects during recessions than during stable periods. On the other hand, education and training interventions have smaller effects during recessions as compared with stable periods. The other differences you can see are smaller and not statistically significant. It is important to remember, though, these are differences in effects across periods. So for some types of interventions, for example, employment services, we don't see big differences in effects from recessions to stable periods, which is what this graph is focusing on. But we do see evidence this type of intervention improves outcomes on average in recessions. So if we hop back to the previous slide, you can see that. So positive average effects, but not a significant difference in effects between recessions and stable periods. Overall, this analysis provides evidence that interventions implemented during recessions that primarily focused on case management or other supports, employment services, and work and work-based learning improved outcomes. Likewise, considering patterns in average intervention effects over time, practitioners and policymakers might consider placing more emphasis on case management or other supports and less on education and training during recessions, or as I mentioned, we defined for this report, times when the unemployment rate is rising quickly. After looking at recessions, we looked at recoveries.
A bar chart shows the average effects of interventions implemented during recoveries. Case management and other supports led to an increase of $1,025. Education and training had an increase of $1,590. Employment retention services had an increase of $481. Employment services had an increase of $1,381. Incentives and sanctions had an increase of $920. And work and work-based learning led to an increase of $1,506.
Remember that we defined a recovery as a time when the unemployment rate is decreasing quickly. Unemployment might still be high in these periods, but conditions are generally improving. So 5 of the 6 types of interventions we considered improved outcomes on average when implemented during recoveries. We see the largest effects for education and training and work-based learning interventions. Both of these types of interventions improved average outcomes in a manner equivalent to boosting annual earnings by $1,500 or more. The only type of intervention without a statistically significant average effect during recoveries was employment retention services, which aim to help people who have jobs keep those jobs. We also compared interventions' effects during recoveries and stable economic conditions.
A bar chart shows the differences in average intervention effect during recoveries versus stable periods, converted into annual earnings terms. During recoveries, case management or other supports had an average increase of $2,249. Education and training had an increase of $48. Employment services had an increase of $400. And incentives and sanctions had an increase of $462. Having a lower average effect during recoveries were employment retention services with an average decrease of $42, and work-based learning with a decrease of $264.
There was only one statistically significant difference. Interventions focused on case management or other supports had much larger effects during recoveries than stable periods. Again, remember that this is just saying that only one type of intervention was statistically significantly more effective in recoveries versus stable periods. As we saw on the last slide, almost all types showed evidence of improving effects in recoveries. So overall, when we looked at recoveries, we found that many types of interventions improve average outcomes during this type of economic condition. We saw the strongest improvements in interventions aiming to build people's job skills and experience, so those that focused on education, training, work experience, and work-based learning. There's less evidence supporting interventions focused on employment retention services during recoveries. Therefore, practitioners and policymakers could consider targeting resources towards interventions other than those focused on employment retention services during a recovery, when the unemployment rate is falling. Okay, so we're going to come full circle back to our summary slide. When we take a step back, it's also important to note patterns across economic conditions, as we did at the start of this talk. This is especially important when we aren't quite sure what economic conditions will be like during our intervention implementation, which is quite common. For example, we might be in a stable period but be worried about a recession coming up, or like recently, when we just haven't been quite sure what unemployment will do, if it will keep rising due to the pandemic, or it will level off or start to fall. This slide, which we previewed at the start of the talk, shows a stereotypical business cycle. First, there's a sharp initial increase in unemployment. That's the recession period in red. And then a longer period during which the unemployment rate declines. That's the recovery in green. And then a relatively stable period after the decline in blue. This is very close to what the Great Recession looked like. For each economic condition, we have listed the types of interventions shown to improve outcomes on average. Interventions with the largest effects come higher in each list. As I said earlier, you can see that different types of interventions are most effective during different economic conditions, and just one type of intervention is effective across all three conditions, and that's the employment services interventions. You can also look across different economic conditions by examining average effects, including interventions that were implemented at any time.
A bar chart shows the average effects of interventions when not looking separately by economic conditions, converted into annual earnings terms. Case management or other supports had an average increase of $251. Education and training had an increase of $1,464. Employment retention services had an increase of $502. Employment services had an increase of $1,150. Incentives and sanctions had an increase of $732, and work and work-based learning had an increase of $1,569.
This graph includes all interventions, regardless of the economic conditions when they were implemented. The largest effects are for education and training and work and work-based learning interventions. We also see that case management or other support interventions have the smallest and statistically insignificant effects. This is particularly notable given that these interventions appear to be very effective during recessions and improved outcomes to some extent during recoveries. These findings can be used if you want to do long-term planning on intervention implementation, but they also highlight trade-offs in the choice of which intervention to implement. In particular, work and work-based learning and education and training interventions have the largest average effects when we don't look separately by economic conditions during study enrollment. But neither of these types of interventions is shown to be effective in all three economic conditions. On the other hand, employment services improve outcomes on average in recessions, recoveries, and stable periods, but their average effects when we don't look separately by economic conditions are somewhat smaller. Okay, altogether, this analysis shows that intervention effectiveness can vary in important ways based on economic conditions. Some types of interventions appear to be successful only in certain economic environments, while others show more generally positive effects. But it's important to note that, and this is the good news, in each type of economic condition, some types of interventions have been shown to be successful. So, regardless of the economic context, there should be programs that can help. It's also important to note a few caveats on our conclusions. First, although we show different patterns by economic conditions, it's certainly possible that the differences we find are driven by differences in interventions, clients, implementation, or context. For example, it could be that individuals who are more driven to succeed are more likely to seek services during recoveries or during recessions, and that pattern could lead to higher intervention impacts during these periods. Additionally, implementers should keep in mind the economic conditions in which they operate. So we classify economic conditions based on changes in the national unemployment rate. This might not actually be a good measure of your local conditions, conditions for people with low incomes in your area, or conditions for the specific population or group of people with which you work. As Diana mentioned, to learn more, you can find information on the Pathways Clearinghouse website, and the brief and shortly the report associated with these findings will be available on that website, and also the ACF OPRE website shortly. And now I will turn it over to Diana to lead a discussion with our panel and some Q&A with the audience as well. Thanks.
That's great. Thank you, Alex. So now we're excited to turn this over to Julie and Christina to help us walk through the results and to help think through the implications. So Julie is going to share a little bit of her perspective overseeing Region 9, which includes great variation across states. And then Christina is going to provide her thoughts focusing on her perspective from CalWorks.
Thank you, Diana.
Sure. And I'll just say one thing really briefly. Julie, you got me. I do want to start with you, but I was hoping you could offer your insights about the way that state administrators may begin to think about this as they consider like how they'll apply the findings in their states. I know you've talked about there being great variation there, but if you can start with an overview of your role and then just talk about some of the issues that state administrators might grapple with, I think that would be really helpful.
Sure, thank you. So my role in Region 9, I'm the TANF program manager. I work with a great team to partner with states and tribes in conducting the statutory and regulatory oversight of those programs and assisting them in administering effective TANF programs. In terms of the application of these findings, it's interesting. Actually, Christina and I had a discussion about this very topic several months ago, and so I think many states are and TANF jurisdictions are thinking about this and have been thinking about it as they've pivoted a lot during the pandemic. I think that the pandemic actually required many administrators and jurisdictions to look at how they were doing their case management and to strengthen and improve their engagement with clients, and that often included strengthening their case management approach. So I think that many administrators have already started, not necessarily applying the findings, but taking steps that reflect these findings. Across the board, it's different in every region. Every TANF jurisdiction is different. Every program is different. So the application of the findings will be different in every jurisdiction. It could be extra challenging in some jurisdictions like Hawaii, where they operate a federally funded TANF program and then a parallel program for folks who fall under COFA. So one is a state funded program and one is a federally funded program, and there has to be parity between the two. So when the TANF, federally funded TANF program implements something with a service or a support, they also have to do the same on the COFA side. They call that program TAONIF. So there are challenges like that, creating parity and equity. I think that in some cases we have jurisdictions that have very strong partnerships with workforce investment. So in those jurisdictions, the application of these findings will be predicated on and supported by these relationships that folks have between workforce investment and TANF, and will be more easily implemented. So I think the bottom line is that it's different in every region how these could be applied. Some states and jurisdictions will have more challenges, and some will have, I think, some built-in springboards to applying these very efficiently and effectively through their relationship development and their pivots that they've made through the pandemic.
Thanks, Julie. That's helpful. So I'll take us to the next question. So for this, I want to turn to Christina. And I think for me, like when I think about the findings, the pieces that stand out to me immediately are the impacts on case management that we see during recessions. That's the first thing. And then the second is employment retention services emerging as having modest but important impacts across all economic periods. So I'm curious, as you've interpreted the findings from the paper, can you share any lessons that you think practitioners and policymakers should take and any considerations they should be thinking of?
Yeah, thanks, Diana, for that. And again, Christina Mesa, I oversee the CalWorks program here in California, which is our TANF program. And in California, our programs are administered by the counties. And so we are more so of an oversight agency, but we help develop some key policy in the employment services arena. And so as I was listening to the findings and going through the brief, I think what came to mind for me was to consider findings around interventions in program design in both current and future program investments, given what we know about our current economic conditions, focusing in on employment services as a stable support, given its importance in all of the economic conditions as highlighted by Alex earlier. I also think that the findings shared are helpful when navigating resources to help inform how we invest and how we partner with other agencies, departments, and providers. Julie just touched on this, but for example, our Workforce Innovation and Opportunity Act partners, our WIOA partners, as well as the broader workforce development system, who may have components built into their programs and within their menu of services that align with some of the successful interventions, particularly around employment services, again, that are proven to be effective in all economic environments. And so it's critical as we build up these partnerships that they're done so in a way that establishes and fosters those different approaches and interventions. I also had here in my notes some regional considerations. So how we respond and design our programs when considering intervention strategies should also be informed by the unique economic conditions that are faced by the different regions across our states. And Julie touched on this as far as taking those very considerations across Region 9, but in California, a lot of our regions have very different economic reactions and are on different timelines when considering the recession and corresponding recovery. And it varies from rural regions to urban areas, and then also our areas that serve our tribal partners and communities. And so taking in that whole lens around an equitable approach to how we think of the interventions, I think is really critical as well. And in terms of some of the cautions and how we cater our services based on those local economic conditions, I think that there are other factors that program administrators in human services should consider, like the state economic investments that may be coming our way. And in California, I think of the care economy investments that move through this budget cycle, which will likely result in some significant job growth in some health fields and health industries and that care sector. And so keeping a pulse on those investments can help us as administrators make those connections to the types of interventions within education and training that'll result in positive or result in actual job growth in those particular sectors. And so I think that's where that tool, the Pathways Clearinghouse website tool, is super helpful to help us explore some of those historical practices that are supported by evidence in their successes in kind of being specific in reacting to the investments in those specific industry sectors.
That's really interesting, Christina. I like that perspective of, right, like the multiple pieces administrators have to keep tabs on, but looking where the growth is and thinking about that as you think about services. That's great. So I'll move to the last question. Alex talked about this, of course, but different types of interventions, of course, are effective during different periods. And education and training have the largest effects during recoveries and stable periods. And then the next largest effects were found for work and work-based learning approaches. And then I mentioned this before, but employment services emerged as the only type that's effective across all phases. So just thinking about that piece for a moment, and we can start with Julie. But do you think there are lessons that administrators should be thinking about when they're thinking about their own specific services? And are there ways to make tweaks to practices based on economic conditions? How feasible is that? So I'd like both of you to answer and think about that question.
Thanks, Diana. What I've observed is that that jurisdictions have already been doing this. They've made those tweaks. They have through the pandemic. States and tribes have learned, have had to pivot, and they have proven to themselves they can make those tweaks. And it's findings like this that I think are really helpful in, as Christina was pointing out, in kind of providing a map or some geography to work from. And the findings, I think, help to create that map and help states and jurisdictions and tribes to identify where they should devote their resources, better plan. But I think that many programs have already proven to themselves that they can make those tweaks and those pivots in the context of the pandemic. And so I think that's really created a environment for innovation and to take this type of information and to run with it in a very effective way.
That's great. Any other thoughts, Christina?
Mm-hmm. Yeah, I think for me, kind of building on what Julie was sharing, and as we continue to recover, case management based on the data that was shared today continues to be a needed support for the families that we serve as we enter into a time of recovery. And so ensuring resources that are dedicated to those interventions that have demonstrated positive financial outcomes for our participants are obviously important to consider. And I know for California through this budget cycle, we were able to increase the amount of funds to support case management. So it's helpful to see that investment was made and it will hopefully be fruitful, right? As again, we move into this period of recovery. And so I also want to flag too, I touched on it in my last response, but just as we make these considerations and we kind of react, right, as we build our program designed to be supportive based on some of the successful interventions and given those local economic conditions, I think it's really, really important to continue to consider that whole equity piece, not just from a regional perspective, but also from that person perspective, right, ensuring that we're building in supports that consider folks that may not speak English, right, or have varied status, and especially as us in California, we're thinking about how we're going to serve the new arrivals from Afghanistan. So building in components and interventions that have a focus on things like vocational ESL built into education and training, if that will result in a positive outcome for the folks that we're serving. Things along those lines, right? Keeping that equity lens and focus on the investments we make around these interventions.
I really appreciate that. It's, sort of thinking about these findings and the types of interventions or with primary services that we've called out, but making sure to look at details about the specific populations as well. And for the reasons you mentioned, Christina, there are details about that. That's really helpful. All right. So I think we can transition to questions from the broader audience. And I see that folks have already been putting their questions in the Q&A box, so please continue to do that. We can jump right in with some of these. So Alex, I'll send this first one your way. The question is whether we looked at the results by gender in addition to the findings you shared.
Yeah, that is a great question. Of course, we know that recessions and recoveries can matter differently for men and for women. They can also matter differently for people who are, younger workers or older workers, and by race and ethnicity. Many of the studies that Pathways Clearinghouse reviews do look separately by gender and by other subgroups. And in this analysis, we include a control for the share of the study population that was female, to try to help handle some of those sort of confounders that I talked about. That it could be that interventions that serve particular types of people cropped up more in different economic conditions. So we don't want that to impact our findings. But for this analysis, just given the types of data that we collect currently for the Pathways Clearinghouse, we weren't able to look separately by gender or other subgroup. I know that there's effort underway on Pathways to do some of that work, so that will be exciting to see those findings come out in the future. I was really interested by this question and would love to hear, I don't know if we are able to do, we can't hear what the audience thought. I would be very interested in what our panelists might expect in terms of how we could think about intervention effectiveness across economic conditions and gender. It's an important question.
I can start, Julie. So I know for us, right, the majority of the folks that we serve within our TANF program in California are women. And so I know that historically through this pandemic, we've been looking at the impacts of the recession, of recovery, but also just on jobs in general around women, and how there was a max exodus, right? And so I know that that's something that we've been following and thinking through. And as we kind of look at those interventions and those critical supports around things like case management, right, or employment services, how are we doing so in a way that'll cater the fact that a lot of folks had to leave their jobs to care for their families, or other various reasons, right, that we saw, which is unprecedented and different than previous recessions that we've experienced. And so it'll be interesting. Obviously, we're still learning to think through how we can build in solutions that better serve those populations. But I know that some of the investments that I mentioned earlier that are coming to the state, especially around the care economy, will likely build some supports for the family, right? That holistic approach, building in some supports, some needed aspects around care, but also do so in a way that kind of creates more jobs and job growth for those that are interested in moving into that particular sector.
I don't really have much to add, just the emphasis, as Christina indicated several times, on equity and parity in terms of supports for things like childcare, for inclusion and access. I think those are really important to consider and to be proactive about. But I think on the federal side, I'm hoping to see supports for things like that, continued supports.
Great. And I'll just move us on to some of the other questions that are popping up. And I hope I'm paraphrasing this correctly, but the question is saying that, incentives and sanctions seem that they're not the most effective across economic context. And I'm wondering if the panel, so Alex, Christina, and Julie, if you can talk about the implications of that finding, that would be great.
Just that, I'm not a practitioner, but just in my observation across in partnering with program providers, I don't think sanctions and incentives they're short term, right? They don't invest in the long term. They don't create a solid foundation. They are reactionary sorts of interventions, and I think that that's why we see that they're not effective. That's just my 2 cents from a broader perspective.
Yeah, I would just add, so it's another super interesting question. The one economic condition where we saw a positive statistically significant effect for incentive and sanctions type interventions was during recoveries. And that actually followed the, small existing research in this area. The idea that the only time or a time when these types of interventions are most likely to have any kind of impact would be when the economy is growing and the jobs are more available. So that may be a particular one to really keep an eye on where on the context.
And then for us, I don't think anything else to add. I think Julie and Alex covered it, especially the whole view around sanctions and some of the historical use or misuse of sanctions, especially around particular populations within California, specifically around for folks, people of color that we serve. And so I know that some of the roots and causes around sanctions may not be built in a way that really fosters and supports those individuals in their success. So.
All right. And I just want to note there's one question. It looks like someone started submitting a question about non-custodial parents, but if you can submit that again, your question may have gotten cut off. We can go back and cover that. We have another, and this is for everybody again, but Alex, maybe you can start. This question is, why might case management or other supports be so much more effective than recessions and recoveries as compared to other stable periods? After this, I want to transition to Christina because of the way that you talked about your shift in funding. So can both of you comment on that?
Yeah, thank you so much, Diana. That question has been on my mind a lot since that was one of our major findings. And I would say that the unfortunate part, our unfortunate thing about our analysis is we really just weren't set up to show why certain types of interventions show evidence of effectiveness in any particular economic condition. We can kind of speculate, but that's going beyond the data. I guess in terms of speculation, it could be that case management is particularly useful for giving folks a leg up in terms of connecting to jobs when unemployment is falling or rising, so when there's volatility, and is maybe less of a leg up during a more steady time. As I mentioned in our caveat slide, it could also be that this finding is explained by some other factor. So, for example, people who are especially, people who face more or fewer challenges may be more or less likely to connect to case management in these different kinds of economic periods. And as I mentioned, we put some controls into our model to try to address that, but that could always be there. So I would love to hear from Christina and Julie, of course, on their thoughts about what might drive this interesting finding.
I can only speak to it anecdotally, but in times of crisis, case management is the gateway to engagement, and engagement in the chain of service provision and in the chain of client success. Engagement is key, right, to creating a path for that client and working with them. So that's my 2 cents about case management. Christina, sorry, I jumped in.
All is good, Julie, and I think that's really helpful too. Context too when we're considering. So in California, I mentioned there was a new budget investment through this last budget cycle, so just July of this year, to increase the amount of case management that's offered to the folks that we serve, just because it was recognized by counties who are the ones that are actually delivering the services, right? So the frontline staff, that there was an increased need in providing that particular service, especially given our current conditions. And so that's why that investment or that shift was made during this budget cycle. But I think the reason being very much aligns with what Julie shared and what Alex shared. And I know that there's not a whole lot in terms of like why it's more successful. But I know for us, we always attribute case management to barrier removal. And so there may be some unique challenges that a lot of folks are facing given the unique condition of dealing with the pandemic. And so those supports are needed, and to make sure that we were mapping out a successful plan to addressing those needs for clients. Case management is the tool to be able to do that.
That's great. All right, and I think that may be all the time that we have for questions, so I'll just move on and let folks know how they can continue to stay connected to this work.
The social media handle for Mathematica is @MathematicaNow. OPRE is @OPRE_ACF. For the latest updates, use #PathwaysToWork. The Pathways website is pathwaystowork.acf.hhs.gov.
So I think the team has already provided a link to the brief in the chat, out into the Q&A so that everyone has that. So please definitely take a look at the brief. The paper will be out shortly thereafter, but that is available. And then certainly you can stay connected with work that's coming out from the Pathways Clearinghouse by following us on social media. You can follow @Mathematica Now or @OPRE_ACF for the latest updates, and we use the hashtag Pathways to Work. You can also join the email list from the homepage and definitely visit the website. And I imagine you all may have follow-up questions. You can definitely reach out to any of the panelists.
Email Pathways at pathwaysclearinghouse@mathematica-mpr.com. Diana McCollum is at dmccallum@mathematica-mpr.com. Alex Stanzik is at astanczyk@mathematica-mpr.com. Julie Fong is at jfong@acf.hhs.gov. Christina Meza is at kristina.meza@dss.ca.gov.
Was someone going to say something? Julie, I didn't want to catch you if you had another thought.
There was just a great question and I know we don't have time, but do you think the findings apply to workforce investment programs? Yes, absolutely. And I think DOL is currently in the midst of a project to look at creating parity in their case management approach to the case management approach that TANF uses. So I think that yeah, there's proof in the pudding for sure, and that this is definitely applicable.
I'm glad you caught that question. Yeah. Anything else you want to say there, Alex? But I definitely think the findings are applicable.
Yeah, absolutely. I would just mention that some of the interventions included in the Pathways database would certainly be those that were funded or administered by WIOA and related predecessor programs.
Great. Well, that's all the time we have. We want to thank you all for participating in this webinar, and we definitely encourage you to visit the website and take a closer look at the brief. Thanks, everybody.